what advice would you give to the families that are caring for those loved ones to navigate these complex medical journeys?
You have to ultimately you have to meet every person where they're at. And the reality is a lot of people can't have hope for themselves. They kind of get in these spirals. This is as good as it gets. There's nothing else that can be done for me. And what the family members have to do is find out where their loved one's at and just meet them where they're at and just not give up on them. Have hope. And sometimes all you can, part of being empathic is suffering with someone. I'm sorry, that's the sympathy. So I'm getting sympathy, suffering with someone. And so sometimes the family member has to just like be in their presence and just suffer with them, research, be prepared, and then just be there so that when they're ready to make changes, they can. And that's the hard part because I'm a doer. I'm a go get done kind of guy. And many of my patients, it's just I have to be present with them until they're ready to move on with stuff. And so not giving up and being educated. I think education is a big thing because with all the marketing and social media and Facebook and all the stuff out there that just focuses on shiny objects, news trends, or controversies and doesn't focus on actually deep, meaningful stuff. You have to find those sources of education information, which is one of the reasons why I've done over 400 blogs on my website. We have the stage. I think we have over 1,000 videos and stuff on the YouTube channel. On my podcast, we're getting ready to hit our 100th episode. I put so much education stuff out there because I want people to have resources. I've had probably over 500 or 600 books recommended to me. I've vetted and read about 200 of those. And I have a reading list on my website of books in this field. Anything from learning about healthcare, Immortal Life of Henry Lax is a really cool book that helps you learn about our healthcare system. Blind Spots by Marty McCary is one of the books on there. The Disease Delusion by Richard Bland. It's like a really interesting book about, our system. He's like the grandfather of functional medicine. I have all these great resources there. So I think people just need to find information that's from a vetted, from a source they know, like, and trust, and then just get educated because that's a big part of it. When everything outside says this is as good as it gets, COVID, what happened with the pandemic is a great example. People believe that we're going to die. I mean, and don't want to go into that because that's controversial. Might gets canceled. But the point is that, we believed a lot of things that just weren't true.
And I hope that's what we're accomplishing on this podcast a bit too, is giving people some of that hope, giving them some of the tools to be able to fill the gaps between what's real and what's, just inflated out there. And so you have a lot of hope and it's obvious in your practice. How do you go about balancing that hope with realism when people are facing severe or life-altering diseases?
I mean, what do you mean by realism?
Well,
You
I
know,
mean, yeah, I guess that's a tough question because, realism, we're almost talking about not having realism because realism can be, it's hopeless, but we're going to have hope. So I guess maybe, what is realism to you as you look at, people with these severe conditions that others are saying are uncurable?
So let's talk about cancer
Okay.
because that's about as bad as it gets, right? You got this diagnosis, and I'll give you a story and talk about a book that people can read on my reading list. Of course, right? I had two patients several years ago. They're both in their 70s. One was we diagnosed with malignant mesothelioma, and that is usually a slow-growing cancer. I mean, it's pretty horrible to treat, and you die from it. It's horrible, but it's usually 3 to 5 years out. You're not dying in a month or two. I talked with this guy. His wife came in. We made the diagnosis. He was having some neck and back pain. The CT picked up the mesothelioma. In the room, his wife was crushed. She was like bawling, like her husband. She knew her husband was going to die. Now you've got a couple of years. She was crushed, and in his face, you could see that he was done. Like seeing his wife suffer, it was almost like his eyes were blank. His eyes looked like the eyes of my grandmother the day after my grandfather's funeral, to be honest with you. And he died a month later. He should have lived for 2 or 3 years. Different patient, same time frame. We diagnosed him with a renal cell cancer. Now, renal cell cancer, usually you're dead in a month, metastasis. His was huge. It's quicker cancer. Dr. Hartman, he was actually 83. Dr. Hartman, I've lived a good life. I know where I'm going when I die. I got great grandkids. I'm happy. He lived for 4 more years. So a diagnosis that you should live 3 or 4 years, died in a month. A guy who should have died in 3 to 6 months, died 3 to 4 years later. And it's amazing how much your mindset affects your physiology.